Once you have diagnosed that the patient probably has Parkinson's disease, how do you go about treating them, and at what stage do you call somebody like me, the neurosurgeon, to say consider DBS? If you could just elaborate on what is the normal treatment protocol and at what stage is surgery considered.
Okay, Levodopa is the best drug we have for Parkinson's disease. So if you look at this study, there are in the 10 years back, there was one concept was there. So they believed that levodopa was not the best drug because levodopa was there for almost like 40, 50 years. And when you start the levodopa, the patients will have lots of dyskinesias or fluctuations like that. Fluctuation means the patient will have on, sometimes they will become within 3 or 4 hours off. So they thought that levodopa should not be the first drug to start. So they started with dopamine sparing like pramipexole, selegiline, something like that. If you look at this study in Italy and Ghana, Ghana is from Africa, eventually they found that levodopa, the diagnosed Parkinson's disease very early, around 3.5 years, and they started with levodopa. But they developed wearing off around 5 years and dyskinesias around 6 to 6.5 years. In contrast, in Ghana, Africa, because um, their medical system is not so good, they diagnosed the Parkinson's disease around 5 years, and they started the levodopa around 6 years. But eventually, they also developed wearing off and dyskinesia around 6 to 7 years. So overall, when we compare these two groups, even if you start the levodopa early or late, they both develop dyskinesias. So levodopa, this proved that levodopa is not the culprit, not the cause for producing dyskinesias or wearing off. This is the disease process itself, the cause for the dyskinesias and wearing off. So, other thing, lots of our patients think that they should not start levodopa. They will want to take less levodopa. Like probably I'll talk in Tamil and English. Most of the people will know that. நமக்கு நிறைய பேஷண்ட்ஸ் வந்து லியோடோப்பா எடுத்தோம்னாக்க உடனே வந்து அது தப்பு, 2 மாத்திரை 3 மாத்திரை எடுத்தோம்னா போதும், நிறைய மாத்திரை எடுத்தோம்னாக்க அது வந்து தப்பு அப்படின்னு நினைச்சிட்டு இருக்காங்க. But if you look at this one, in this study they showed that levodopa வந்து yearly start பண்ணிருக்காங்க, like probably 1 to 2 years. And in this group of people, they started the other medication like levodopa இல்லாம like pramipexole or selegiline or other dopamine sparing medications. If you look at that one, in the disease like yearly, if you start the levodopa, they require more levodopa after 2 years, 3 years, and they have lots of off and on. But if you see this group of patients, they had like they require more levodopa around 3 years, and they had off and on later on. But after 7 or 6 or 5 to 6 years, if you see this patient, those who are on regular levodopa, who start on levodopa earlier and on adequate dose, they have less disability. அதாவது அவங்களோட பார்க்கின்சன்ஸ் டிசீஸோட ப்ராப்ளம்ஸ் கம்மியா இருக்கு. But those who are not on levodopa, they have lots of troubles, lots of disability when they are not on levodopa or when they are off levodopa. So it means levodopa is the best medication for our patients. And don't think that the extra levodopa or excess medications is wrong. If you take less medication or if you are not on levodopa, that in a longer run it produces more troubles for you rather than adequate medications or more medications. So when we call Vishnavan sir or when we call the neurosurgeon, when the disease progresses, initially when you take 3 tablets a day, the patient will have a very good benefit. But when the disease progresses, the 3 tablets is not enough. If they are taking a tablet every 6 hours, usually when the disease progresses, the levodopa will work for 3 hours, and the next 2 or 3 hours it will not work. So they will have severe off period. Off period means they cannot move, they have lots of tremors, lots of freezing, rigidity. This is what, when the disease progresses, troubles them. So at that time, they need to take extra tablets like 4 tablets or 5 tablets, like add on like pramipexole or selegiline or other medications are required at the time. It is very, very important for us, for our patients to monitor whenever they are taking the levodopa, like if they are taking the levodopa at 8 o'clock, something like this, they need to monitor when the levodopa is started to act, how long it is acting. Like if they're taking at 8 o'clock, the next dose is 1 o'clock, means how long it is working, and whether during the off period, whether they are able to do their work or not, or they require any support. And how bad is the dyskinesia? When the levodopa is more, they can have dyskinesia. So is the dyskinesia are mild or moderate? They have freezing of gait or falls during the off period. Lots of fluctuations. Like take a whole day, if they have off period for more than 2 hours a day, or if a patient is on 500 milligrams of levodopa or more. Not only levodopa, like if they are on 3 times levodopa plus something like pramipexole or something like salicylic, whenever other medications, you should take all the medications into account. So it called as levodopa equivalent. So 500 milligrams levodopa irundaka, or if the patient is having more than 2 hours of off period, around 1 hour of dyskinesia, like morning 15 minutes, afternoon 15 minutes, evening 15 minutes, night 15 minutes, overall more than 1 hour of dyskinesia, it means the patient requires more medications or more medication adjustment or advanced therapies. So most of the patients, like they will come into find within after 4 to 5 years, they will be on almost more than 5 tablets of levodopa or 3 tablets of levodopa plus some other medication, pramipexole or salicylic, something else will be there. Obviously, they will be on 2 hours of off period. College half an hour, madhyana half an hour, evening half an hour. Within a day, 2 hours of off period and 1 hour of dyskinesia study. If it is mild or moderate, what we need to take into account is whether all these things, the off period and dyskinesias, are troubling the patient or not. Whether it impacts the quality of life. That is what the important question we need to ask the patient. Somebody will say that even like they will be like a active or daily work போயிட்டு இருக்கிறார்கள். So அவங்களுக்கு பார்த்தீங்கன்னாக்க even ஒரு half an hour or 1 hour of off period is very very difficult for them to manage because their quality of work is affected. Some patient வீட்டில் இருக்கிறவங்களுக்கு 2 hours is fine. So it depends, it varies about each and every individual. So in that case, இந்த மாதிரி ப்ராப்ளம் இருக்கவங்களை immediately we'll ask Vishwanath sir to